April 2025 show with Advantage Athletic Therapy. Whereabouts you guys located?
We're at 381 Cedar Street.
You'd think by now I'd know that, wouldn't you?
Oh, that's okay.
Let's just take a second and step back because it's the springtime and I want folks to understand what you and Paige do at Advantage. So talk to me about what it is that you guys carry and what services you guys carry and what people can expect.
We both provide athletic therapy coverage and massage therapy. Athletic therapy sounds like it's just for the athlete, but it's for anybody, recreational athletes. It could be somebody that hurts their back outside, repetitive stress injuries at work, kind of any of those aches and pains or major injuries. We're happy to assess and provide a rehab plan and get you back to better than you were before. Our massage therapy is just like it sounds, like any types of deep tissue relaxation, different techniques, whatever you're looking for in your treatment is something that we can accommodate to. We can do it more sport specific. We can do it basically however you prefer. And yeah, we have a variety of patients coming from patients as young as 7 to I think my oldest patient is 87 right now coming in for massages. And
That's
everybody
cool.
seems to get a little bit different things out of it. And yeah.
The massage aspect too. I think one of the things I appreciate is just there's a difference. Like that, you do the sort of a relaxing massage or the deep tissue. Do you mind just explaining those two differences because that can be critical when you're starting out?
Well, it's certainly about what a person is expecting from it. So I think that if you've never had a massage before and maybe you're going off of what you've seen in movies, it's like calming, relaxing, and that would be more of like that relaxation massage where it's more gentle touch, trying to take down that heart rate, relieve stress. And then if you're thinking about coming in for a therapeutic massage or deep tissue, it
Yeah.
could be something as simple as you have chronic elbow pain related to like a golfer's elbow or a tennis elbow, and then getting in there, stripping out the tissue, doing some mobilizations, working out an injury, but first assessing that, not just kind of coming in and being like, this is what hurts, like work on it. It would be, let's test range of motion. Let's do some special orthopedic tests. Try to get to the root of the problem to try to fix the issue as opposed to just being like, this is the area that hurts. Because then what we would describe that as is we're chasing pain. And that's kind of a slippery slope into not accomplishing our goals. So we want to try to figure out what's going on and then use massage therapy techniques to eliminate the problem.
And with the relaxation component of it, it seems, I got to be honest with you, usually you feel like your body's just been released from a grip.
Definitely. And that's the thing that a lot of people don't realize is that pain or increase in headaches and the tension, like that can be related to stressors, right? Some people hold their stress in like their GI tract. Some people hold it in tension in their shoulders. So if you're coming in for a relaxation massage, like we can definitely do deep tissue therapeutic massage as well and incorporate that into that, because that release and that even like the nice neck traction, like all those things are going to start to combine to have that therapeutic effect and then leave you feeling more relaxed.
So when you take that stress away, I'm going to use the neck, for example, because I find that's where I hold a lot of it.
Okay.
Does it actually let the body relax? Is that what it's doing? Like
Yeah, so
when it
you're
feels like
working
it's released?
definitely. So like different techniques can kind of work on different systems within the body. You have to kind of understand the science behind it more, but even using like gentle, we call it like a stroking technique. So it'd be like simply like running hands through different patternings of muscles, like that can have a relaxation effect on like the whole system. So yeah, like, and then what you're going to see is less tension within the tissue. And then that's kind of like an introductory technique. And then you're going to get deeper into the muscle and, yeah, working through there. That's kind of how like the principles of massage work. It's not like you're just going to start and kind of dive right in. You
Right.
want to like prepare tissue, and yeah, certain introductory techniques can be very light, relaxing, and still have a therapeutic effect.
And that sort of the end result, make better blood flow throughout the body?
Blood flow is huge, yes. And like
Okay.
I wouldn't necessarily say like you're gonna feel like a systemic like pulse or anything like that. Some people do feel like that in like endorphin release. But certainly the idea of like an injury site is we want to bring blood to the area. Or if things are stagnant and you have something like a trigger point within a muscle, then you're releasing that trigger point, ensuring blood flow. And that's why we often recommend like staying hydrated. Hydration after a massage, before a massage, those are key for allowing blood to move freely through the body.
One last question, massage times. Can they book an hour and a half? What do you recommend?
Typically 30 minutes, 45, or an hour, whatever you feel. Some people like to come in quick lunchtime, like neck and shoulders, real quick. Other times people want to come in and do like a full body, and we typically do 60 minutes for those. So it's whatever your preference is, whatever your time allows, but we're very accommodating and kind of can make it all work.
That I now I'm curious, is it neck and back the usual? Is that what you see the most of probably with work?
Yeah, I would say in terms of like work related stuff, and then runners will sometimes come in, and they've been like right now. There's a lot of people training for marathons, so spring
Yeah.
marathons are on the horizon. So it's like legs, glutes, calves, feet, like all that stuff is like kind of a target for that specific demographic. So it does vary, but I'd say like your typical like workplace overuse, working at a desk, yeah, neck, shoulders, back, all that stuff.
Hey man, thanks for doing this. Take care.
Yeah, no problem. You as well.